Welcome to this update for Wholesalers from IMVO. My name is Leonie Clark and I'm the General Manager here. On the session today, we're going to cover the following topics: IMVS, EMVS updates, alert management, wholesaler specific issues, planning for end of use and learn, Brexit, COVID, your interactions with IMVO, and the ask of wholesalers. So turning first of all to IMVS, EMVS updates. So if we look at the number of packs uploaded to the IMVO repository since it was set up, we can see that there are over 550 million packs in the system. So this is quite a large number considering that there's an average of 100 million prescription medicines sold in Ireland every year. So if we were to assume 2 years packs in the system, we would expect to see maybe 200 million packs in the system. But the extra packs we see here are due to the fact that we have very large numbers of joint packs with the UK. So when you have a joint pack for two markets, Ireland and UK, the data for all of the packs gets uploaded to both in repositories. So that's one of the reasons why we see our repository number is so high. Looking then at IMVS releases for 2020 to 2021. So when I use the term IMVS, I mean the Irish Medicines Verification System. And in terms of these releases, our priority is to reduce alerts, improve operational efficiency and fix bugs and defects that are picked up during testing and during incidents that arise with the system. So in 2020, we've had 3 major releases this year, 2 of which were focused on providing the full set of NCA reports. So these are reports that are made available to NCAs or national competent authorities to assist them in their supervision and enforcement activities. So here in Ireland, that would be the HPRA for wholesalers and manufacturers, and then the PSI for pharmacies. The most recent release of the system, which was R7 and which went live in mid-November, it made several key changes for end users. So in relation to expiry dates, if there's a mismatch between the data in the barcode for the expiry date and the data that's in the repository, if the only piece that doesn't match is the day, but the month and the year do match, no alert will be raised. In this situation, an exception will be generated and you and ourselves will be notified, but it won't be a full-blown alert. It's now also possible to distinguish if you get an alert that says that the pack is already decommissioned, now you'll be able to see whether the pack was previously supplied, decommissioned, or reactivated in the same location or in another location. So that's quite useful information. We're planning 2 releases then for next year, one in April, and the testing of that release will begin in January, and we're already looking at what features will be included in the second release in October. Turning to the EU Hub, one of the things we want to flag to you again is that there have been some changes to the EU Hub since the new version R1.8 went live last week. And as a result of that, OBPs and manufacturers are now receiving extra categories of alerts that they wouldn't have got previously. So they're now getting all A7 and A24 alerts. So these alerts relate to packs already decommissioned, and A68 alerts, which are batch ID mismatch alerts. Now, the reason they didn't get these alerts originally was that these alerts are primarily caused on the end user side. So the A7 and A24 alerts are generally due to some repeat transactions by end users, and the A68 alerts are typically due to end user software problems. However, the OBPs wanted to get these alerts and the hub was updated to allow them to get these alerts. It has had significant knock-on effects for them, because I know we've heard one company last week told us that they used to get 40 to 50 alerts per day, and now since this went live, they're now getting 2,000 alerts per day. So one of the things we did was we had a discussion here with the HPRA as to what level of investigation MAH is needed to carry out in relation to these alerts. And the advice we got was that they are not required to carry out a documented investigation except in the following circumstances. So where the MAH, know that they have caused the alerts due to repeated decommissioning transactions when the packs are under their control, or where an end user, and that would include yourselves as wholesalers, contacts them about such an alert, or where IMVO contacts them about such alerts. So in those scenarios, they would be expected to investigate. Now, turning to alert management. So I suppose the big question is, what do we learn from alerts and scans? We continually gather and analyse information about alerts. So we look at the details of each alert generated in the IMVS, and we also do daily scan counts. We get feedback from manufacturers, end users and FMG software providers about alerts that we follow up with them in relation to, and sometimes we're proactively contacted by them about alerts. We also exchange information with IMVO about alerts, and we also discuss alerts and patterns of alerts and root causes of alerts with other NMVOs. When we look at the alert numbers and the locations and the patterns of alerts and also the products causing alerts, this allows us to identify likely root causes. And this then allows us to achieve our objective of eliminating avoidable alerts, because if we know what's causing them, we can take action. So if we look at all of the alerts that we've seen since February 2019, and we can see the overall picture here of the total number of alerts, the total scans, the number of packs uploaded, and the number of batches. And going into a little bit more detail, in recent times, we have been analysing all of our alerts over the last few weeks, and on this graph we can see it shows an upward trend, but in actual fact that's because we have a couple of spikes here that are distorting the figure. So we have a spike of 3.89% and 2.14%, and I'll come back and explain a little bit more what they're about. If we strip out alerts that are caused by marketing authorization holder transactions and also intermarket transactions, and we just look at the alerts that are caused by scanning of packs here in Ireland, we see a different picture. So we see alerts that are hovering between 0.2 and 0.4%, and so our underlying alert rate is probably in the region of 0.3%. We see in this graph, if we look at the dips, typically the dips are Sundays, and one of the things that's been quite interesting to note is that alert rates tend to be better on Sundays. We think it's because pharmacies are not so busy and they scan a little bit slower, which seems to help. And also then we think certain locations that are causing a lot of alerts are closed on Sundays, so they're just not feeding into that alert rate. If we look at the type of alerts that we've seen in the last few weeks, the A7s, this is where packs are already in requested state, and actually they're linked in with some spikes that we've seen in recent weeks where manufacturers have repeated transactions on large numbers of packs, and that results in a lot of these A7 alerts. We still see pack not found alerts. Now sometimes that's because the data hasn't been uploaded, sometimes it's because the software is not reading the data properly. The same with the A68 alert, batch ID mismatch. A24 are tied in with the A7s. Batch not found, we're seeing less and less of those, and the expiry date mismatch issue has largely gone away. If we look at the sources of alerts, and again we track it here over 3 separate weeks, week 43, week 46 and week 49, and you can see the sources of the alerts can vary week on week. And if you see in week 49 we had a particular issue with marketing authorization holder transactions causing alerts. You can see intermarket transactions can cause significant numbers of alerts. So in week 43 and week 49 we had approximately 20%. The manufacturer MAH data upload issues have largely gone away. End user procedural errors, we would see they cause a certain proportion of alerts. Similarly, scanners, softwares and so on. So it gives us a good picture of what we're dealing with and where we need to focus our efforts with alerts. Look at the alert rates. On the 8th of December, our alert rate was 2.14%. So that's number of alerts as a proportion of the total number of scans. Now, if we strip out the manufacturer and the IMT related, the MAH and IMT related alerts, and we look simply at what's i.e. end users, and we're down to 0.27%. Our lowest ever alert rate was 0.04% on a Sunday back in September. So that's the sort of levels we're aiming to get to. If we look at the bottom of this graph, we can see across Europe in mid-October, that's the latest data we have to hand, the average alert rate was 0.4%. Lowest was 0.1% in Slovenia. Our Slovenian colleagues have really cracked all of this, and they're typically down at that alert rate level. So we look very closely to see what they're doing and learn a lot from them. And our Portuguese colleagues would have been the highest that week. So if we summarise where we're at with alerts, I suppose one thing to remind ourselves that during the use and learn period that's still in operation, most FMD software shows a green result in scanning, even if an alert was raised. So this will change after use and learn ends. So our alert rate has fallen from a high of 23% in spring 2019 to approximately 0.4% now, and we're aiming to get to 0.05%. Two key reasons for this. MAHs appear to be managing data more effectively, and I suppose rather than this being a second reason for the reduction rates, what we're seeing now is because we've cleared out all of the big data issues that were hiding a lot of the end user issues, they're now accounting for a greater proportion of alerts, and they're now accounting for a greater proportion of our time in terms of follow-up. I've already mentioned the alert rate tends to be lower on Sundays, and I've also mentioned the distortion of the alert rate due to spikes, and just there's some hard examples there. So we had 7,000 alerts on the 3rd of December due to one MAH repeating transactions on a bulk transaction, and then we had 4,000 alerts on the 9th of December due to a system issue. There was a timeout issue there. Now that issue is now resolved. If we look at the causes of alerts on the end user side, we still see out of scope packs scanned, devices, Indian packs, linear barcodes, scanner configuration issues, software issues, and as I've mentioned, these are becoming more apparent as other root causes are eliminated. One of the things we've noticed, which is quite interesting, is that some of the FMD software they use is web-based, and when they use it with certain browsers, they get alerts, and if they use it with other browsers, they don't get alerts. So that's the type of thing we're really trying to get a handle on at this stage. Another issue we're seeing a lot of in recent times is data splicing. So this is where data from two barcodes gets mixed up if they're scanned back to back. And this is a combination of a software and a scanner issue. And there was one particular software provider we've seen this with, so we've been working with them to get that sorted out. So that issue should disappear. Another thing we see happening in pharmacies and hospitals is that where there are bulk packs, they decommission them every time they dispense from them instead of just doing it once when they first open them. So again, there's been a lot of communications about if you've got a bulk pack or you're splitting a pack, only dispense it the first time or only decommission it the first time it's opened and dispensed. We've also seen situations where hospital and clinics within the HSE infrastructure are decommissioning packs that have already been decommissioned in the wholesaler under Article 23. So the wholesaler didn't realise that they were set up to do their own decommissioning in the HSE site. So this is something we've been dealing with the HSE project team. Another issue that we've come across, and it's one we did anticipate when we made the decision to introduce Use and Learn. So during Use and Learn, wholesalers like pharmacies have been told to ignore alerts that are generated when they scan packs. And as you know, when returns come back into you, you're required to verify them. If those packs have already been decommissioned and the pharmacy has sent them back without reactivating them, they will then end up, because the alerts at wholesale level are not being acted on as per the instructions, those packs are being put back on shelves and sent out to other pharmacies in a decommissioned state. So when they try to decommission them, they can't. So this is something we're very aware of, and it's something we're thinking about a lot in relation to the ending of Use and Learn, because we would like to get these packs cleared out of the system before we end Use and Learn for pharmacies. So this is something we're working at how to do this. On the EMVS side, so when I use the term EMVS, I mean the broader European Medicines Verification System, and comprising the hub and all the connected national systems, including our own. And we see that errors at hub level during data upload can lead to alerts. One of the other things we see is that there are greater risk of alerts with multi-market packs and intermarket transactions, because there are additional transactions here involving the hub and other national systems. So for example, with the multi-market pack, if you've got a joint UK-IE multi-pack, what happens there is if that's decommissioned in Ireland, a message then is sent to the hub to tell the UK and Maltese systems to mark it as decommissioned, and that's all extra transactions. And if any one piece of the EMVS is not working, that message can time out and lead to alerts. Similarly, intermarket transactions, these arise where we have, say, Irish packs that find their way to other markets. So say a batch is bought by a parallel importer in the Netherlands, and they then are verifying those packs at goods inwards. So when they verify those packs, they don't find them in the Dutch system, and then they have to the Dutch system sends a message to the hub. The hub then says, okay, we see that those packs are in Ireland, a message is sent to ourselves, goes back to the hub to say, right, they're verified as whatever, and then message back to the Dutch system from the hub. So there's multiple transactions there, and if any one of those pieces isn't working, then we can run into problems. And one of the things we certainly see is timeouts during IMTs cause a significant proportion of alerts and spikes. So that's where one piece of the system, the hub or the national system, is not getting the message through fast enough to each other, and the alert times out. So there's fixes being considered to the system to eliminate some of these problems. On the MAH side, these issues are well known, the data upload issues, and I think these are largely sorted out. Data for packs serialised pre-9th of February not uploaded, and again, we think most of these packs have worked their way through the system. Errors in product master data we still see. So for example, a pharmacist scans the pack and in their FMD software, the name that appears on screen doesn't match what's printed on the pack, and that's because the data has been set up incorrectly in the hub for that pack. We've already seen that they can cause multiple alerts with repeat decommissioning. So for example, we often see that a batch is marked as export and then it's done again. So we could suddenly have 7,000 alerts, as you would have seen there. And also then some of the pre-9th of February packs simply didn't have some of the data in the barcodes because, you know, there was no legal obligation to have them fully ready until the 9th of February, but they were sent out to the market serialised with barcodes on them, but some of the data is missing. So again, this is an issue that's largely going away. And one of the things we are doing at the moment is liaising with United Drug and Uniphar to try and get a handle on, from their perspective, as they would do most of the primary distribution activity in Ireland, how many of these packs are still likely to hit the market over the coming months. So in terms of activity to reduce alerts, I've touched on some of it already, but just to summarise, we're following up with MAHs and alerts where we see high numbers of alerts, where we see unusual alerts, we see unusual patterns of alerts. The HPRA and IMVO also engage with MAHs and OBP causing most alerts. So the HPRA, we have to provide them with lists of alerts per MAH per product, so they follow up with the ones that are persistently causing the most problems. And that's had a huge impact. IMVO now also writes weekly to MAHs and OBPs causing the most alerts because they can see all of those at hub level. We have a lot of interaction with end users and their FMD software provider regarding software and scanner issues. We work very closely with the HSE FMD project team regarding issues in hospitals and other HSE sites. So they have a dedicated project team that manages all aspects of FMD in the health services. That's been a very effective setup. We produced a scanning video and check and fix your scanner guidance earlier this year, and we sent it out to pharmacies in February, and we've sent it out again in August, and that's available on our website if you want to have a look at it. We have run webinars for all the different groups, including yourselves now. We have made a number of fixes, as I mentioned, to the IMVS and the hub to address system-related alerts, and then also we've been recertifying the end user FMD software providers. We've kind of given them an expanded set of requirements that we expect them to meet with their software and require them to carry out testing to provide evidence that they meet those standards. Now, wholesaler specific issues. So just to say, we do see the issues with scanners and softwares tend to be similar with wholesalers as for other end users, but the process to resolve them can be more complex because there are more scanners in a site. Also, FMD functionality can be integrated into warehouse systems. It can sometimes be hard to actually track down the precise source of a problem. In terms of Article 23 decommissioning, where you do this for a customer, obviously make sure they meet the criteria for Article 23 decommissioning and that they don't intend to scan the pack themselves, because if you decommission them and they scan them themselves, as I said already, that will lead to alerts. And the HSE has a list of the Article 23 sites within the health service, and you can contact them for that. We'll give you their contact details at the end. One thing just to flag to you, if you are scanning large quantities of exempt medicinal products receiving from the UK, bulk verification is not supported for these transactions. Now, one thing to say in relation to EMPs is they are legally out of scope of FMD, but the Commission's Q&A document and safety features strongly recommends that they do be scanned, and we know that a lot of people are scanning them for this reason. This is one of the areas we're looking at post-Brexit because we're aware that there will be serialised packs in Great Britain after Brexit, put on the market in Great Britain after Brexit, for which no data will be uploaded to the system. So if people continue to scan the EMPs after Brexit, they are likely to see alerts of them. So I think we'll be communicating quite clearly in the new year that really these packs should not be scanned, notwithstanding the Commission advice, because particularly the ones coming from the UK, if you do scan them, and they were placed in the GB market after Brexit and there's no data in the system, they will generate alerts. So the advice would be not to scan these. If you're looking for a list of designated wholesalers for a specific product, provided your FMD software has been programmed to do this, it will deliver the report you need from the IMVS product information database. So if you can't find this in your system, have a chat with your FMD software provider about this. As I've mentioned, the whole question of returns and the returns coming back decommissioned and how we're going to deal with these, that is something we're looking at as part of the planning for ending use and learn to make sure that we don't have alerts due to decommissioned returns being cycled back out to other pharmacies and being scanned by them, and they find that they're already decommissioned. In terms of planning for end of use and learn, just to remind you that all decisions about use and learn are made by the Safety Features Oversight Group, which comprises ourselves, the Department of Health, the HPRA, the PSI, HSE, and also there's a representative of the Private Hospitals Association. So we meet regularly every 6 to 8 weeks to review progress with FMD in Ireland and Europe. We constantly share information with IMVO and the other NMBOs about actions to reduce alerts and planning for ending stabilisation periods, and that information is all fed into the Safety Features Oversight Group. And there's extensive planning and activity underway relating to ending use and learn, and that's involving all stakeholders and regulators, and it's a key priority for ourselves. So to give you an example of how regulators are involved, the PSI is now very heavily involved in addressing pharmacies that are not scanning and, encouraging them to get going as soon as possible. And in the new year, it intends to focus on pharmacies that are scanning but not doing a lot of it, to remind them of their obligations to do so and step up the activity. Just again to remind you what the advice about alerts is during use and learn. During this period, you're expected to scan all packs. Now, in the case of wholesalers, you're not that doesn't mean every single pack that comes into the warehouse or that you send out. There are certain requirements as to when you're expected to scan. So, for example, returns have to be verified. You also then have to verify packs received from anyone other than the manufacturer, the MAH, or their designated wholesaler. And also then, if you're decommissioning Article 23, for Article 23 customers, obviously you'll be scanning those packs. If there's an alert during this period, the advice is to continue to supply the pack unless you have an overriding concern that it is falsified. If the pack looks like it's been tampered with, do not supply it even if the barcode scan was fine. And report any concerns you have about an anti-tamper device as a quality defect to the HPRA. We are aware from a number of wholesalers that there are problems with anti-tamper devices, that they can be very flimsy and can break easily, or sometimes they're even hard to see if it's something like a glue dot way down in a flap on a carton. So we have brought these issues to the attention of the HPRA. The whole question of anti-tamper devices is not within scope of what we do, but certainly we see our role as collecting information and making sure people are aware it's something that needs to be addressed. So one of the things the Safety Features Oversight Group is to define various prerequisites for ending use and learn, and these are the following. So first of all, we need the alert rate of 0.05%, ideally excluding the spikes caused by MAH activity and IMTs. Now, to give you an idea of what 0.5% looks like in practice, that would be roughly 950 alerts per week in Ireland, and given that we have 2,000 end users, pharmacies, wholesalers and hospitals, that would represent roughly 1 alert per location every 2 weeks. So it's not a disproportionate burden to have to manage. We also need all end users scanning all packs as per the delegated regulation, because our concern is if they're not scanning now and then we end use and learn and then they start scanning, and then there's all sorts of software and scanner problems that really should have been sorted out before now, and it'll cause a lot of difficulty for everyone. The avoidable alerts minimise, again going back to the scanners, the software, the MAH data, the system issues. We try and make sure we've identified all of these and done what we can to get rid of them. Next thing is that it's very important that everyone be clear on what to do if there is an alert, including clear responsibilities and deciding if the pack may be supplied or not. We will also need a fast, efficient process for communication between the parties, and the reason for this is after use and learn ends, an alert will have to be investigated until it's either resolved or a root cause can't be found, in which case it has to be reported as suspected falsification to the HPRA. So clearly, every alert that's generated means either a patient doesn't get a pack at all or there's a delay in them getting a pack. So it's really important that we have quick procedures for getting these alerts sorted out. And also that we have plans in place for products like high-tech products. If you can't get a speedy response on an alert, how are we going to make sure that a different pack can be made available quickly to the pharmacy? So these are the sort of issues we're looking into with the IPU, and we will be talking to the HSE as well about some of these issues. We also need to understand the impact of Brexit on the supply chain and on our alerts. We're hoping that there'll be relatively few alerts due to Brexit, but we don't know. And also the supply chain changes, like we could see wholesalers learning very busy because a lot of the stock is diverted from Northern Ireland, is diverted into the UK via IE. So that'll be interesting to see how that all plays out. We also need to think about the capacity of end users to deal with alerts in the face of challenges of COVID. We know there are challenges in pharmacies. There's the whole social distancing piece. There's the need to safety in terms of use of scanners. There's also, if you've large numbers of people that have to stay at home because of an instruction to restrict their movements or self-isolate, that can have significant implications on capacity to even do the basics, never mind manage alerts. So this has all been looked at. And then also, the advent of the COVID vaccines has raised questions about the IMVS's ability to cope with all of that, and that's something I'll come to later on. So in terms of preparing for end of use and learn, we're intensifying efforts to raise scanning levels, we're intensifying efforts to reduce alerts, we're literally chasing down every single root cause and doing what we can to get to the bottom of them, and we're working very closely with, as I said, end users, their software providers, with manufacturers, and I have to say everyone has been really helpful and really cooperative in this, which has been fantastic. Work is ongoing on alert management guidance, which will describe the roles and responsibilities of everyone, end users, MAHs, IMVO, HPRA, how communications will work between the parties and the expectations of all of the parties. One of the things that's currently happening at European level is that we're mapping alert management processes across Europe, and we're doing this within a group that's been set up at IMVO level with the NMVOs. Basically, we're trying to come up with a single process for managing alert across Europe. So that's very useful information that's feeding into our work locally. As I mentioned before, we're recertifying the end user FMD software providers with an expanded set of requirements. In terms of support for alert investigation, we're currently recruiting a service manager to strengthen the team. We're also implementing a local alert management system called NMVS Alerts, and I'll speak more about that in a moment. A lot of communications planning going on to ensure that end users and MAHs will know what's expected of them, where to access support. We will intend to work with the software providers to get links from the end user software to help our decision trees and what to do next, where they get a red or an amber response. We will customise these for wholesalers versus pharmacies. We're conducting a survey of community pharmacists to understand their support and training needs, and also we really like to hear what you as wholesalers need from us. So what training, what support, what can we do to help you be ready for the end of use and learn? Any ideas, suggestions, requests, just send them in to us by email and we'd be delighted to get those. A little bit about NMVS alerts. So this is a collaborative online tool that allows different parties to communicate about alerts, i.e. end users, IMVO and MAHs, and also potentially the HPRA who was interested could get involved as well in using it. What this allows end users to do is to provide information on the possible root cause of an alert, to send a photograph. Often manufacturers just want to see a photo so they can have a look and see what's printed on the pack. They don't often need the pack back if they can get the photo. We can mark alerts as results. If we know, for example, there's been double decommissioning at pharmacy level or there's a scanner problem, we can mark them as resolved. And similarly, the MAH can report the results of investigation. So if we can't see any end cause at the end user level, the MAH can look into it from their side and they can tell us all what they found. So there's two ways this can be done. We can either, in terms of using the system, end users and MAHs kind of accounts in the system, or we can just, where there's an alert, send them a one-time link to log on and communicate what's happening at their end about it. What we have noticed is from our feedback from other countries, there's quite a few of them have both end users and MAHs using the system. So our colleagues in HR is Croatia, Lithuania, Malta and Slovenia, and more are planning to do this. So there's several countries using this NMVS alert system. I think it's 9 or 10 at this stage. What we're interested in is feedback on what would work for IE end users and MAHs. So if you have any ideas on this, we'd be interested to hear them. We've been running a pilot over the last 4 weeks with 2 MAHs, 2 wholesalers, 1 hospital and 2 pharmacies, and the objective was to identify the level of interaction required to close alerts. Now, we successfully closed out over 500 alerts, so that was we meaning ourselves and all the different parties communicated to each other, and we were able to see what was going on. The target was to do this within 3 working days. We largely met that objective. Feedback from all the users was really positive, and we've identified a number of potential features to improve the system. And all of the countries who use this NMVS alerts, we work very closely together to put forward ideas to make it better and more user-friendly and more meaningful for everyone involved. We're planning to do another round of piloting in January, and we will have more participants. And if any of you would like to volunteer for this, just email us at info@imvo.ie. A little bit about So there's been a lot of planning for Brexit over the last, I'd say, 2 years at this point, and we've had significant activity, and really our objective has been to ensure that FMD constraints do not impact on the Department of Health and the HPRA's efforts to maintain supply post-Brexit. So we've engaged continuously with IMVO, with the UK NMVO and other impacted NMVOs. We've also kept the Department and the HPRA updated on progress with various IMVO proposals, and we've provided them with information to support their contacts with the Commission. So it's been a very good collaboration and very consistent messaging about the issues for Ireland from ourselves and the Department and the HPRA, and I think the messages have certainly been heard at European level, which is good. The situation has been greatly complicated by the NI protocol in UK withdrawal agreement, which provides for the application of FMD in Northern Ireland after Brexit. and obviously the ongoing political discussions on the future trade arrangements, which as of now, the 18th of December, are still not resolved. So what we do know about what's happening with Brexit. So in relation to Northern Ireland, the existing UK MVS medicines verification system will remain connected to the EMVS, and it will become the Northern Ireland system from the 1st of January. The data for packs uploaded to the UK system before 11 p.m. on the 31st of December, so these are called legacy packs, will be retained, including data for joint IE UK packs. So you might say, well, why is it 11 p.m. rather than midnight? And it's because everything in the EMVS is measured with reference to Central European time. So GB, England, Scotland and Wales end users will be disconnected at 11 p.m. on the 31st of December. So after that, they will no longer be able to verify or decommission packs, or they won't be able to access the UK product information database. And that's important, for example, in terms of checking who will be the designated wholesalers for a given product, where their product's the UK product. Northern Ireland end users will remain connected, be obliged to comply with FMD. There has been a lot of discussion in the UK about whether packs sent to GB after Brexit should no longer be serialised, and I think originally everyone assumed that would be the case, but apparently based on consultation with NHS sites and other locations that use barcodes for multiple purposes, the MHRA has decided not to require manufacturers to stop serialising packs. It's up to themselves to decide whether they do this or not. What's still unclear is how many packs aimed for Northern Ireland will be supplied by the Republic of Ireland, and that's something, if you've got any information, we'd be very interested to hear it. The other thing is whether companies will continue to serialise single market packs intended for GB, so that's obviously England, Scotland and Wales after the 1st of January 2021. As I mentioned before, if these are serialised and they're brought into Ireland as exempt from distant products, then we will get alerts if they're scanned, as the data won't be uploaded to the EMVS. So we will be advising not to scan these packs. The Commission, we've had a lot of queries about whether or not wholesalers who export packs to UK sites or GB sites after Brexit will be required to decommission them for export. The Commission is expected to grant a time limit derogation from the requirement to export these packs sent. That should actually be GB, not the UK. So this is the requirement in Article 22 of the DR. And this derogation is part of a plan by the Commission to allow certain flexibilities to small markets adversely impacted by Brexit, including ourselves. The actual details of this hasn't been finalised yet, and we will communicate them as soon as we have more firmed up information. Returning briefly to COVID-19, there's been a lot of discussion in recent weeks about the implications of COVID vaccines for the EMVS in terms of data and transaction upload. And I suppose when we saw 1.3 billion doses coming into the EU, it was very clear the system could not cope with 1.3 million packs. So a lot of questions have been asked, and there's been a lot of discussion by ourselves. There have been discussions with regulators, with the Commission, looking at factors such as, will these vaccines be serialised? It seems likely now that the early batches won't be, but that the later batches will. How many packs will be uploaded to the MVS? So this goes back to the 1.3 billion dose, but it now seems that there'll actually be large numbers of doses per serialised packs. So we've heard figures of 1,000 doses in each Pfizer serialised pack. So now we think the numbers of packs coming into the EMVS are likely to be in the order of about 25 million packs per year. So that's manageable. Who will administer the vaccines and who will decommission them? Now, we don't think there'll be any significant changes here. For example, we don't anticipate the GPs will be required to decommission vaccines. They haven't been doing that up until now for flu vaccines. But it is something we've had to think about, because if a decision was made to have them decommissioned, that would be 2,500 extra end users for us. So I think, thankfully, it looks like that's not going to happen. But we may have some additional sites that we need to onboard, but we'll be ready to do that. And then also, will there be any exemptions from the requirement to decommission? This is on the table in some countries, and the Commission, I think, is looking at this with the national authorities. So IMVO and the NMVOs have set up a task force to gather data and to identify what steps are required to manage COVID vaccines within the EMVS, and they're now confident that the system will be able to cope with the extra packs and transactions. So that's a very positive development in the last 10 days. In terms of IMVO activity, we have informed both the Department and the HPRA that we'll do whatever is necessary to support the rollout of vaccines in Ireland, because obviously it's really important for everyone that this goes well and efficiently, and that FMD doesn't become a problem. So to that end, we have been continuously exchanging information with them, and they with us. So that's been very helpful, particularly in terms of things like the work of the COVID task force, in the HPRA in the department have been able to help us with that. We will continue to monitor developments closely and take whatever steps we can to ensure that we're ready for serialised COVID vaccines in Ireland. So in terms of wholesaler interactions with IMVO, so if you've got any queries about alerts, just email us as alert support. That will guarantee you get the quickest response, because that email is picked up, is monitored by the people who deal with alerts in the team. If we've any queries about your alerts, which happens from time to time, what we do is we typically send them to the super user that was nominated for your account in the IMVS. Now, if it's the case that if you're not sure who that person is, just contact us and let them know. If you want the alert query sent somewhere else, just let us know as well. And it's really important that our communications are going to the right person. So we need them going to someone who can take some action. So again, if you've any queries about who that person should be, you want to give us a change, just let us know. In terms of managing your connections to the IMVS, one thing we want to flag is really important is that every physical location where scanning takes place must be connected separately to the IMVS. So we have seen situations where, say, a headquarters is connected as a location, and then all the scanning that takes place on different sites in different parts of the city or in different towns is recorded against that location. That is not acceptable. We need to be able to see in the system the addresses at which scans take place. So if you've got different sites and different addresses, you need to set them up as separate locations in the IMVS. And if you have any queries about that, just contact us and we'll help you get that sorted out. There's no problem at all with that. If you have a location that's previously connected to the IMVS closes, so we need to remove that and disconnect them from the system. And this is done by deleting them from your organisation's accounts. You need to log into the NMVS portal and you need to let us know as well that you have done this. If you're opening up a new site at a new location, so it's just another location on your existing account, you need to first of all contact us by email to register the new location, and you need to attach a copy of your WDA so we can complete the legitimacy check. So similar to you doing bona fides checks on customers, we have to legitimacy check every address that's connected to the IMVS to make sure that they have the appropriate authority to use the system. So for example, a WDA, or in the case of a pharmacy, that they're registered with the PSI. Once we confirm all is in order, your super user logs into the NMVS portal to add the new site as a new location in your account. And if you need to add or delete a location, please contact us by email to get instructions on how to do this, because it's not difficult, but it's just knowing exactly what to do, and we'll make sure we make it clear for you what needs to be done there. In terms of troubleshooting, if you have any trouble connecting to the system, check the live status of the system. So if you go into the link I've given you there, it shows the status of all of the SolidSoft national systems, all 12 of them, and you'll see Ireland there in the middle. So hopefully we're green. So if we're green, then you know we're good. Then next step would be contact your IT department, your FMD software provider help desk. And if you're still unable to resolve the issue, email us at info@imvo.ie and see what we can do to help. So the ask of wholesalers. If you handle FMD packs and are not already connected to the system, get connected now. That's really important. Now we know that the HPRA are out and about inspecting, and we've had quite a few people contact us very quickly after these inspections where they hadn't been connected to get connected, or where they haven't had a site connected to get that site connected. So that's we'll help you do that and make sure you meet the HPRA requirements after an inspection. We would ask you to intensify your efforts to reduce the alerts caused by software and scanners, so scan as much as possible within the scope of what you are obliged to scan. Analyse all alerts or exceptions to see if you can ID and fix the root causes. One of the things that the HPRA has requested, one thing we would support strongly as well, if you could do this, this would be really helpful. It's not an obligation, but it certainly would help hugely. If you can consider scanning with the scanner set to verification mode, one pack from each incoming batch to verify that all is in order, and notify the MAH if you see any batch specific problems. So this is where you scan one pack, you can't find the data, and you scan 2 or 3 more, you still can't find the data. A quick notification to the MAH will very quickly allow them to get that data uploaded, and it means we could save a lot of alerts down the road if these packs end up in pharmacies and they're all scanning and not finding the packs. So that's something that you can really help us with. I would say if you could start analysing the status of packs being returned, so we can try and get a handle on how many of these are coming back already decommissioned. And certainly if you see a pattern of certain pharmacies constantly sending back decommissioned packs, it would probably be worth contacting them and letting them know. Let us know if you'd like to join round 2 of the IMVS Alerts pilot, and obviously then, as I mentioned before, please do let us know how we can support you as Use and Learn ends. So I've given you some useful contacts there for more information, and at the end there I've included the HSE FMD project teams that I mentioned earlier in the presentation. That's the end of the presentation, and we'll now open it up to questions and answers. Thanks very much.